If you could tell us how old you are, how tall you are, and how much do you weigh?
Okay, I'm 55. I weigh about 202, and I'm 5'8".
We are one day after surgery.
That's correct.
How are you feeling?
Feel good. I mean, I thought it was going to be more painful, to be honest with you. Actually, the procedure was pretty smooth. Towards the end, it was getting a little bit uncomfortable, but that's normal because of the time. But honestly, I went home. I slept well. I didn't have problems sleeping. No pain. Just draining the stuff. It was new to me. But other than that, this morning around 12, had a little bit of pain, so I took my medication and went away. So it was much easier than what I thought, but the results are much better than what I expected, to be honest with you. I was expecting a change, but not what I'm seeing. So I'm very happy with the procedure. You did a good job, man.
Thank you. That's amazing to hear, honestly.
No, honestly, because, coming here, being new and stuff, and I'm like, man, am I doing the right decision? And even financially, I'm okay to do it, but it was just more worried, or, every time you go do a procedure, but man, I put this in God's hands, and it's the best thing I could have done for myself, honestly. I feel like when you buy a brand new car or something like that, that excitement, like it feels good, because especially when you see the mirror and you see the difference. Even my wife was joking with me. She says, man, that boob is almost as big as mine, and she was joking, but still, psychologically, or, when you go to the gym or when you go to the swimming pool and the beach, so definitely the results. Now it gives me like motivated to start losing some weight and, getting healthier and stuff. So definitely, thank you.
No, I appreciate it. Today we're doing a revision gynecomastia case. So this gentleman had liposuction of his chest a little over a year ago. He had fullness in his lower chest, and he went to a provider who did that procedure, but unfortunately didn't fully resolve the problem because there's gynecomastia glands that are also contributing to the appearance to the lower chest. So he's coming back because really the goal with this kind of procedure is to make the chest flat. That's what the guys are looking for. And it's a little bit disappointing when they see someone and they don't solve the main issue, which is gynecomastia. We could see that it's a little bit asymmetric. He has it more on the left than the right. It's going to be a similar workflow to the other cases that we do, where we utilize ultrasound-assisted liposuction to liquefy the connective tissue and the fat surrounding the gland, and then we're going to carefully dissect it out. So our operative plan for the patient, it's the same for most patients. We make our access point on the inferior aspect of the areola from the 3-6 to the 9 o'clock position. We mark out the sternum. We make our sternal notch. We go across to the 9 o'clock position. The discrete access point that I mentioned, if he raises his arm, we do it in the armpit hair. If he kind of pivots a little bit back towards me with the arm raised, then we make a straight shot to the 3 o'clock position. And with the arm down, we follow the lateral pec to the 3 o'clock position. Then we mark out the inframammary crease. So this is going to be the lower border of our anesthesia. And if he raises his arm a little bit, we put the arm back down. And if he flexes his chest and relax and flex and relax and flex. Same thing on the opposite side, 3, 6, 9 o'clock position. We raise his arm, and in the armpit hair, we make our access point down to the 9 o'clock position, arm down, flex the chest, and relax, and flex. And we're following the lateral pec margin. We go across from the sternal notch to the 3 o'clock position. We mark out the inframammary crease. And if he flexes again, and relaxes and flex. So I'm palpating the gland on this side. So our upper border of the anesthesia is going to be about this area. And that is our operative plan. So we gave you a little bit of a sedative, and it's close enough to the time of surgery where everything is fresh in your mind. What do you remember from yesterday?
Nothing really, to be honest with you. It was just like going into sleep, and then I could hear you like somebody was talking, like if I was dreaming. I can honestly tell you it was less painful than getting a tooth pulled. Honest. I mean, I've had my wisdom tooth taken out. I go clean my teeth, and they do that under, and they put local on this, that numbing gel, whatever. It was less painful than getting a tooth pulled out. So I highly recommend it.
Were you feeling nervous at all coming in yesterday morning?
Yes, driving here I was, but then again, I said, you know what? I just put it in God's hands and relax. You also guys make me very, very comfortable, And then when you gave me those first sedatives, I was like real calm.
Do you remember the first poke of the numbing medication?
Not really, not even the numbing. That's the funny part, because the only thing I think I had was the sedative, so it's not like I was under or anything. I was feeling towards the end the effect of maybe going away, but then when you guys would put me more, I wouldn't feel it. I was just like...
Yeah, so, no, the lidocaine is very effective for that.
It was very, very effective. I was very impressed.
So you don't remember me doing... I did kind of re-lipo around it to kind of release it. Do you remember that part? No. You don't remember the hissing of the vaser?
Honestly, no. Honestly, it was like I was asleep and dreaming, honestly. I would hear you guys talk once in a while. That would wake me up, and then, after a while you're laying down in a certain position, I remember you guys kept telling me not to move my legs. That's the only thing I could remember.
That was towards the end.
Yeah, towards the very end, yeah. Because I was just feeling like, man, I need to get up and do something.
Yeah.
But I wasn't like, it was funny because it was like I did that, but I didn't realize I was under surgery. It's like, I thought I was home asleep and I needed to move my legs.
Yeah. I mean, it is tough to lay there for hours in the same spot. It is.
But other than that was the worst. I didn't think everything was so smooth. I was even telling my wife, man, it's amazing how they can do it without actually having to put you with general anesthesia. Because I don't remember a lot.
Do you remember leaving here after the procedure?
Yeah, I do. I remember my wife walked me down the stairs and everything. And I remember everything. It's just in there, it was like...
Yeah, no, I'm happy that the surgery day was smooth and it wasn't a horrible experience.
And I'm probably sure you took a little bit longer because of the size of that tumor. Yeah. Because maybe that's why at the very end, I was already kind of gaining conscience, because you probably took a little bit longer than expected.
That took a good 2 hours to take that left side out.
It was bad when I saw it, man. And it was like, I can't believe I was carrying that.
Yeah. So let me ask you, how old were you when you first noticed there might be a problem?
I would say it's been around for 10 years, but growing and stuff, I would say the last 5 years. And then when I did that lipo, which was supposed to be, paid somebody to take them out, they didn't do it, they just did the lipo. I was very upset because now it looked more obvious, because it's like the fat around the area was gone, but then that lump was there, so it looked bigger than before. So that was like in my head, I need to get it done, And I just didn't want to get anybody. Even one of our family friends, he's a plastic surgeon, he offered to do it, but I said, no, I think this time I want somebody that just does this, because I don't want to be under. They do whatever they want, and then they don't do what I paid for. So when I saw that that's all you did, I said, you know what, I just got to take my chances with him, because at least that's all he does.
So you never noticed it? You never had it when you were in like middle school, high school?
No, not that I think of. I was very skinny always. Or maybe I had it was not growing fast enough. But no, I mean, it could have been there for years without me noticing it, to be honest with you.
Had you done anabolic steroids 10 years ago when it got a lot bigger?
No, I did steroids like 12 years ago. I did it, but not for long. I did it for about a year, on and off, because I was trying to gain some muscle. But what I've done in the last 2 years, and I don't know if that has caused it. I've been putting the pellets, the therapy, but that's not with the doctor. It's not like the stuff that you would buy, illegally or whatever. That's not that kind of steroids. This was actually at a doctor. They put the implant here because at my age, your testosterone levels go. I think my testosterone was like at 200, so it was very low. I was getting tired. Couldn't sleep. I was losing my hair, and ever since I started doing that therapy, which is a release, it's a time release, and my hair came out. I feel healthy again. I'm not tired. But I don't know if that causes that or not.
Well, you said that it got a lot bigger 10 years ago, and at that time you didn't use anabolic steroids.
Like 10 years ago, that's when I think I used steroids, but only for a year. Because I heard that it could give you heart condition stuff, and I said, no, it's not worth it.
But was that right around the time where it started to balloon?
No, I actually started ballooning the last 5-6 years.
Okay.
Yeah, and then after, what I was very noticeable, it was after the liposuction. Because I think he took the fat out, and then just that thing was just standing there before. It was like if I was fat, all over.
Yeah.
But when they do that lipo, and then you lose weight here, and then this was just sticking out.
It's lucky for you, though. In your teenage years, in your 20s, were you ever self-conscious about taking off your shirt? If you didn't have this?
I was very. I did a lot of running. So I did a lot of track. I did a lot of kung fu, karate, taekwondo. So I did a lot of those stuff, which I had a real flat. I was real skinny, but flat. It's just. I would say in the last 10 years, 15 years, that's where I started gaining weight. I had doing this roller coaster, up and down, up and down.
So it sounds like this really became a headache for you after the lipo.
Yeah, the last year was very noticeable, bad, like the word man boob, like that. Yeah, to that point. Yeah.
And so did your clothing choices change?
Yes, loose shirts and stuff. Yeah, because if I wore like there was a time where I would gain muscle here and lose weight here, but then my shirt it wouldn't look like this. It looked like a hanging tit.
Yeah.
So I would have to wear loose stuff. My wife would tell me, why do you wear extra large? You're large or medium? Nah, I just like them loose, because if not, you can see it.
Yeah, yeah. And now, do you see yourself changing your clothes back?
Oh hell yeah! I'm just what I saw in the mirror right now. I couldn't believe it. There's no way. This is I've gone 20 years into the past. 20, 25 years. Because my chest was flat, just little, like it is right now. But now I'm happy.
So
I wish I would have done it sooner.
That's exactly it. So what I was going to say is, anyone who's going to watch this video is going to...
Man, I highly recommend it. And you know what, guys? If you're out there, I'm probably the most untrusty person. I double check doctors. I double check it. I ask questions. And just since day one, he made me feel very comfortable. I knew that this was the right person because I'm a good reader of people, and just made me feel comfortable. I wish I would have done this earlier. He even told me, hey, 2 weeks ago, there's an opening, and I was still having doubts. I said, no, let's just wait. That, I just put it in prayer and, said, you know what, just put it in God's hands, and the best thing I could have done, honestly. When we have a swimming pool at the house, and when the family gets together, I always get in with a shirt. I never take my shirt off. I can honestly tell you that as soon as you tell me I can go swimming, take my shirt off and get in the water.
We did not get it on camera, but I removed the drains 10 minutes ago.
Yes.
How was that experience?
Well, you said it was gonna hurt and be like burning, but I didn't feel anything, to be honest with you. Nothing. I thought nothing. I didn't feel nothing at all. Just like, are you done? Yeah. I think it hurt more when you were pulling the Band-Aid because of the hairs than the actual pulling of the drain.
We are 1 day post-op. We're going to see him at 3 days post-op, which is Monday. Likely there's going to be fluid collection because of that. There's an empty space where that mass was, and that's where the fluid is going to collect. So we're going to do a needle aspiration. He's an out-of-town patient, but I'm going to be able to see him where he lives because I work in that area as well. So we're going to see him today, post-op day 3, and then probably post-op, I'll see him in 2 weeks.
Okay.
And then after that, 1 month, 3 months, 6 months, and you'll move on with your life. No more gyno ever again. He does have a family history of female breast cancer, so that sample has been sent to the lab and we'll get the results hopefully within a week, and we can just ease his mind that it is benign.
Yeah.
And that'll be it for your gyno journey.
No, I really appreciate it. Thank you. Just amazing. From one day to another, I feel like a different person, honestly.
A weight has literally been removed from your chest.
Yeah, actually, what weight? It was, I didn't believe it was that big. When you showed it to me, it was like, man, it's like, I thought it was like a breast implant or something else.
Yeah.
It was big.
Yeah, bigger than I expected, but it's gone and he can move on, and it's good stuff.
Thank you. God bless you. Thank you. Give it a job. Highly recommend it.
Appreciate you. I'm happy we could deliver.